Hello and welcome back to our monthly podcast. And I'm here with Dr. Christy Moore of Sonora Hearing Care in Tucson,
Hi.
Arizona. How are you doing today?
Doing great. It's hot here.
Yes, it's hot here too. We have similar weather. I'm
Yep,
in
we
Las
do.
Cruces, New Mexico for the viewer, and so it's hot, but I think you guys usually beat us by a few degrees. Have you guys had any rain recently?
Not since the first part of June, so we're hoping maybe this next week we'll get a little bit of rain and get some
Hopefully.
relief.
Hopefully it's all going from here there because we've had it pretty consistent this week. So it's humid and I think I'm living in Texas now. So
Exactly.
uh so we wanted to touch base for the audience of and what the industry considers best practice, right?
Right.
And so I guess Dr. Moore, if you can kind of give me an idea of like what is best practice, you have a number to it. If you can
Yeah.
touch base, and then we'll dive deeper in after you kind of give me that overview.
Yeah, that sounds good. So in the audiology space, we have kind of what's called our 10 best practices for audiology and hearing aid care. And so those are the 10 best practices that we as audiologists, even hearing instrument specialists, should be following whenever we are assessing hearing and primarily recommending hearing treatments such as hearing aids, cochlear implants, assistive devices, things like that.
We look at it as the industry, and hey, this is the industry best practice. Where did this come
Yes.
from?
So this came from primarily the American Speech Language Hearing Association, which is primarily for audiologists, although other organizations, the American Academy of Audiology has adopted it as well as the International Hearing Society website as well. So it's kind of been adopted across the industry for hearing healthcare professionalist.
Now, through marketing, and a lot of times you'll hear best practice, right? And it's used as the marketing. Is
Yes.
this is this an alignment with every audiologist has to adhere to, or can they add and subtract? Like give me a quick kind of, I guess, breakdown of what a best practice means for an audiologist.
Yeah. So best practices means that you're practicing at the top of your licensure, the top of your profession. So that's what you should be doing to basically maximize or give the best professional care, in our case, to a person with hearing loss. There are minimum standards, and that's something that our industry is working on right now. What are the absolute minimum standards that we should be doing, like doing a basic hearing test? What are the components that we should be doing with that? Recommending hearing aid technology. What are the basics that we should be doing with that? This is best practices, meaning that we're taking those minimum standards and we're saying we're going to maximize it, making sure that we are providing a sort of guideline of service for a person that comes into us and is seeking treatment for their hearing difficulties.
Is this something that every audiologist adheres to, or can somebody add and subtract?
Okay, so every audiologist should be adhering to this, but we also know that not every audiologist is adhering to this, and which is part of what we'll discuss with what are the 10 best practices. There are some things that unfortunately do get left out and would not be considered practicing at a best practice level. There are some things that can be subtracted that probably shouldn't be subtracted if you're going to be utilizing best practices. And even some of those, if you're subtracting that, some of the best practices, in my opinion, are should also be termed as minimum standards as well.
I can completely see that, right? Where this is the
Yep,
base minimum, and you should be offering these.
that's exactly
Okay.
right.
So, with our allotted time, viewer, we do try to keep these podcasts and videos to like 30 minutes. So, this may be a multi-video segment and subject matter, but we want to give you the most information you can possibly get. And again, I'm not a professional. I'm actually just a marketer who happens to be the producer of this podcast. But it's like, I come from it as I don't know what's going on in the industry. If I come from it as the user experience or somebody who is going, I I don't have the terminology. I don't have a doctorate. I come at it as almost an average normal person would come at it with these questions.
Yep.
So I guess, Dr. Moore, let's dive into the number one. What starts us off on the best practices?
Absolutely. So I'm just going to look kind of at my screen. I have another screen over here where I have
Yes.
that so I can kind of
Yes.
see. Yeah. So if I'm looking away, that's what's going on. So the number one thing that we want to say is a best practice is developing that treatment plan. So that means someone's coming into the office and they're being assessed for hearing. So they would have a comprehensive hearing evaluation, which is going to be doing air, so listening for pure tones, um, doing a type of testing that's going to be analyzing what type of hearing loss they have, doing some speech testing, and then coming up with a general overview of that hearing. And so, based on that, then we can determine if the person has a hearing loss, what are we going to do after that point. So, this is going to be like where we're going to say, okay, there's a hearing loss present, for example. It's a sensory neural, meaning that it's a permanent type hearing loss. It can't be corrected through the use of surgery or medication. This is something that we probably need to recommend hearing technology, such as hearing aids, possibly assistive devices. So that's where we're going to come up with, okay, we're going to recommend a device to help treat now and manage the symptoms of the hearing loss. So we'll recommend the technology, what level of technology is appropriate for that person in their lifestyle. We're going to talk about, maybe adding assistive devices that might help them improve in certain situations like noisy environments. Then we're going to come up with, okay, based on this, we're going to see you for like a fitting appointment. Then we're going to see you for a couple of follow-ups to make sure that the settings are right, that everything is good. We're going to talk about what like the first year of follow-up care might look like. If we're going to add like auditory rehabilitation, meaning helping you to maximize how you hear now differently with those devices, coming in for maintenance appointments, all that type of thing. So we're going to kind of talk about what that whole plan is going to look like, and not just saying, here's the devices, good luck, and we'll see you later.
Yes. Yeah. So when you describe it as a plan, right? I come into your office the first time I'm entering, I'm looking at that hearing test. Is it something that I go away, and make a second follow-up appointment where you're looking at that information and you're figuring out this plan for me? And also, how do you figure out and how do you learn about like my environment and
Right.
and how that technology would be applied to me or the treatment?
Yeah, what's important to you. So part of that's going to be during the initial appointment that they're coming in. It's not just a hearing test. It's actually doing a comprehensive case history. So we're asking a lot of questions. We send out a lot of paperwork ahead of time to ask like the basic medical health history questions. And then when a person is in my office, we'll kind of follow up with, what brings you in today? Where do you find you're having difficulties with hearing? What are some things you're struggling with? Where are some things you would like to hear better? What are family members saying? What are friends saying? What are some activities that you're doing? What type of situations are you in, or would you like to hear better? So we have kind of questionnaires too that we can kind of help guide those questions to find out, how busy and active is a person? Are they in a lot of challenging environments? Are they in noisy environment situations, group settings? They go to restaurants a lot. They're still working individuals, or are they sitting at home and primarily maybe they go to the grocery store, they go to church once a week, and they love to watch television, or they have the grandkids come over, those types of things. So that helps us to determine then maybe what the best level of technology that the devices are doing, how they're processing the sound can work for that individual.
So the planning starts really as soon as you get that information, that paperwork that's turned in.
Yeah.
And are there sometimes like curveballs that happen that, some people are getting their hearing tested and you're like, whoa, this is, a lot more severe or not as.
Yeah.
Um, and during that planning phase, again, is it almost that instantaneous where you're getting that feedback and maybe it takes you 5, 10 minutes because of your experience to say, this is the plan, this is the trajectory that you need to be on.
Exactly. So, most of the time, most of us, especially that have been in the industry a long time, we can pretty much get almost draw out an audiogram prior to testing the individual's hearing, just because we know from all that experience of seeing different hundreds and thousands of audiograms over the years of what they look like and what that correlates when individuals come in and say, this is where I'm struggling. I can't, I can hear, but I can't understand. I have trouble in restaurants. I have ringing in the ears, all those things, right? I can pretty much guarantee, kind of get an idea of what that hearing loss might look like. And I'm usually right most of the time, but yes, sometimes I am surprised when I see something, or if there's like what we have kind of a 7 or 8 medical red flags of hearing. So if we see something abnormal, we see a difference in how a person may be hearing. We see that they hear better through the earphones than they hear through a bone conduction device. Those might be then we say, okay, our first plan of action is going to be medical evaluation by like an ear, nose, and throat doctor so we can determine what else might be going on with this before we talk about hearing aids or other treatment.
So really just looking at the data, right, and figuring
Correct.
that out.
Yeah.
So, okay, so that's the plan. So I
Yeah.
guess that does that bring us into step two or best practice number two?
Yeah. So using, as you were saying, using the patient-focused income measure, which is not about money
Yes,
or
yeah. When I
income.
saw that, I was like, wait a minute, this term, and again, as coming as a marketer, I'm like, that
Yes.
term is not user friendly, does not build
Correct.
confidence in a buyer, right? I'm like, wait,
Yeah.
you're looking at my income, so
Yeah.
please explain this.
Exactly. We're not necessarily looking at income other than if we are recommending technology. And of course, we want to be mindful about staying within a budget,
Yes.
especially if there's not insurance coverage. That might be the only time we're discussing income. Exactly. So this has to do with think about with the person coming in to see us. So we're going to be doing some assessments, questionnaires, that type of thing. So one of the things we might be doing is asking them questions. There's the hearing handicap inventory for elderly or for adults, and so that's like 10 different questions that ask them things about do you have difficulty hearing in when someone whispers? Do you have difficulty hearing when you're in a noisy environment? Do you have difficulty watching television? Those types of things. So those are some basic questions, about 10 questions that we often make as part of our intake form when they are filling out that paperwork. So we already have that information for them. And then there are some other things like what we call a consumer-oriented scale of improvement, or a COSI. And that is one where we are kind of like asking them, what are 3 main areas that you have difficulty and that you would like to improve your hearing? And what we do with that is that really helps us to get what are 3 main things that they really want to accomplish in improving their hearing. And then we can measure that down the road. How are we doing in those areas? Did we accomplish what we were trying to accomplish? So that can be really helpful in that matter.
How long is that process? I mean, are you looking at weeks? Is it years?
Yeah, it can be as long as we want it to be. So, for example, if they come in and they're like, I want to be able to understand the dialogue on my favorite British television show that I watch. That may happen immediately. That may happen within a few weeks, right? Whereas if they're like, I have this, weekly group that I meet with 4 or 5 of my friends in this particular restaurant, and I want to just be able to hear what's going on at the table that I'm sitting at, and I want to be able to follow that conversation. That might be a little bit longer goal because one, we might be having to do a little more hearing rehabilitation, auditory exercises to practice hearing in a noisy environment. We might be having to apply some assistive devices to help us in that situation. So that might be a longer term goal. That might take us months to kind of assess that. But at least we have that as that's an important goal, and we want to try to see how close we can to achieve that.
I was just thinking to myself, hey, wait, this means I can understand accents better and clearer and faster.
Maybe, and maybe, maybe so, and maybe there might be limitations. Who knows?
Yeah, yes, exactly. We can fine tune it to a particular accent. So we went over two. Now I guess there's some other ones. Actual
There's one more
assessment.
in that measure too that I wanted to
Yes.
talk about. That's in that number two. That's the abbreviated profile of hearing aid benefit. That's one that is essentially about 25 questions that we typically will send out after a person has been wearing their hearing aids for about 2 to 3 months, and that's asking them more specific goals, such as I can hear in a noisy environment with 1 or 2 people, and then it asks them to rate like 50% of the time, 25% of the time, 100% of the time. So it's like 25 of those types of questions that ask them to rate different situations. I can hear television dialogue clearly. I can hear a child's voice clearly. I can go to the grocery store to interact with a cashier. So it's very specific things with their hearing aids. And that's one that we use routinely in our practice after a person has been fit with hearing aids and maybe has had about 2 to 3 months of wearing those hearing aids.
This brings us back to this thing of relationship, but also that consistent follow up where it is not
Correct.
that, we figured out the plan, we set it into motion, and we're done, right? It is that consistent follow up. And I know we've had conversations before about, big box and
Right.
big corporate, agencies and grocery stores offering these things. Is
Hearing
this
care devices, yes.
Yes. And so is this something that they go like, is this a standard for them? Or is it the see your hearing aid and you're attached and see you later?
Unfortunately, this is often not done in a big box type situation or retail chain, only because one, it's about getting the product, getting a mass amount of product to a certain number of people, usually, and especially if you're talking about like Costco, Sam's Club at a reasonable cost. So because of that, they're seeing a high volume of patients, they're selling a high volume of product, and they're not going to have that level of follow-up care. And a lot of these things, best practices, are not going to be done in that type of situation.
I guess great news to hear because
Yeah.
right with our and again because of what I do for a living, the trend is AI, right? We were just kind of joking.
Yep. We were just talking about that. Yeah.
Yeah, and so it's like going, okay, well, here's AI, but AI is not going to give you that follow up. AI is not going to,
Exactly.
it's not going to be that personal touch, that
Yep.
focusing in on that plan. You might be able to have AI develop you a plan, but really these
Correct.
are professionals that are planning your hearing health throughout, I mean, your entire life, really. Once you
That's so
acquire that.
true. And I could tell AI, I could probably tell AI, hey, write me a 10-point plan for so and so that's having these situations and what we want to accomplish. And it could probably write it out for me and I could use that as my starting point. But it's still going to be that one-on-one human interaction that's going to help me explain it or help me to engage with that individual and say, okay, this is kind of our written goal, but let's talk about what that really means, kind of just like what we're doing right now.
And so that does this cover our income? So not the money
Yes,
you make, but the
not the money.
income of the patients that's
Right.
coming in. Awesome. Okay, so that brings us to the use of meaningful clinical tests. So let's kind of
Right.
touch base on number three of best practices.
This is one that I think more and more of us are now on board with. And that has to do with using meaningful tests with regards to especially the number one complaint that most patients come in that seek audiological care from an audiologist or hearing instrument specialist is that they can't hear well in a noisy environment. And so that's like probably one of the number one complaints that I hear in my practice all the time is they come in and they're saying, well, I can hear, but I can't understand. But boy, when I get in a restaurant or I get into a group of 3 or 4 people, I just feel like I really can't hear. We hear that from people not only that have hearing loss or suspect that they have hearing loss, but this is actually showing up in people that have normal audiometric hearing. And so we want to be able to have a way to say, especially to that person with normal hearing that comes in and I do a test and I say, well, as far as how you hear, because we have a standard of what is normal hearing, as far as we are plotting or graphically or objectively measuring, your hearing is within this normal hearing range for an adult. However, if we do a test, say a speech and noise test, where we can have them repeat sentences with background noise and a certain level of background noise that is to simulate more of a real world situation, we can really dive in and see, okay, in quiet, boy, you knock out those words just fine. You have no problem understanding speech in quiet. You have no problem hearing these tones at different pitches within a normal hearing range. But boy, when you are in a challenging environment where you're having to focus on speech and background noise, that's where you really are having trouble. And so it validates that as well. It also helps us with when we're making recommendations for like hearing technology. If someone is really struggling in a noisy environment, I may say, this hearing technology over here is going to do a better job because of how it's looking at that information, how it processes that speech from the background noise. Or we may also want to implement assistive devices such as like a microphone that helps them to hear even better in that situation. So it's really important that we as audiologists are doing this higher level of testing. Absolutely.
We're going down this list, right, of best practices.
Correct.
It kind of sounds like going, oh, we're already, I don't even know how long we're into this podcast, like maybe 10 minutes.
Right. Yeah.
And it's like going like, well, wait a minute, this sounds like a longer process, but it's out, but so my guess is right. You're getting this data from these tests, adjusting, really showcasing this, but also focusing in on that plan,
That's right.
and being able to build all these pieces together.
Test too, like assessing the middle ear system, making sure that that part of the system is working, looking at, reflexes that have to do with how the ear is responding to certain loud sounds, because that can also give us some good information. So it's more than just what we call like a pure tone hearing test or a basic hearing test. This is doing more to kind of evaluate the overall hearing health of a person.
You kind of mentioned it's a word. I was looking at the abbreviated monosyllabic word, like
Monosyllabic. Yeah.
syllabic word test. Like what kind, I guess kind of like what is an example
Yeah.
of that? What
What
I've
is an
never even seen
example?
that before. So I was just like, oh, this is very interesting.
Yeah, exactly. So that has to do with a list of words. So we have like these several different lists that were actually made probably 80 to 100 years ago with using single or single syllable words. So that's monosyllabic, right? So you have words like for example, you have heat. Or you have rain, or you have ran, fed, all those different things. So that's an example of like what a monosyllabic word is. So that has to do with, and they're weighted by consonant, usually a consonant vowel consonant type situation. So that it's weighted so that you have that information. So you're kind of getting, so on a 50 word list, you should be getting most of the sounds that we have in the English language by presenting these words to them and having them repeat them back. So that's essentially what that means. And those are standardized. So we have, about I don't know, 20 different types of lists that we're using, and they have these words, so we can present that over and over and over again, and we should be able to get a very much similar response, and we should be able to look at that data and those statistics over time and kind of see those trends. So that's why we're looking at that very specifically.
And thank you very much for the example, right? Because
Yep,
again,
exactly.
it's that information that we go like, what are we preparing for? What are these tests? What are the best practices? And
Yep,
again, viewer, just to educate yourself and to go like, when if you do go to a big box store, what are you expecting and what are you not going to get versus a professional and a professional audiologist, right? From a
that's
doctor
right.
who is checking your hearing and really taking the time. Okay,
Exactly.
Dr. Moore, is there anything else we want to cover on our meaningful clinical tests?
So I would say, that I think you brought up a really good point. I was just going to talk about that. Like in most states, we have guidelines of what is required by testing to fit a hearing aid, for example. And so those are just the minimum guidelines. So you just basically have to do a comprehensive test, which is just checking pure tones and running some words in quiet. And that's really all you have to do to fit a hearing aid in most states. And so that is why best practices is going beyond that minimum standard.
So that's going to bring us to our fourth and probably our last one to cover on this particular video. So,
Yep.
Dr. Moore, if you want to cover four, and we can go from there.
Absolutely. So that's establishing specific goals. So that's kind of touching at back what we just talked about a little bit before about what is a person's goal. So if we're using like that COSI, for example, that client-oriented scale of improvement, we can already come up with 3 or 4 goals that we want to be able to accomplish. The more specific that we get, the better that we're going to be able to measure that. Absolutely. So again, if a patient wants to be able to hear in a specific type of restaurant on their weekly, group setting, the get together with their friends, we can say, okay, what is realistic for that, and when can we hope to accomplish that goal? Again, some goals may take longer than others. Some may be really fast. They just want to be able to watch their favorite program without having to rely on closed captioning every single time. time. And maybe we can accomplish that in the first couple of weeks. We can check that off and say, that's great. We're making great progress with that. Again, if we don't have those goals, we don't know where we're going. So the more specific the goals that we have, and we might limit it to 3 or 4 because we could probably have 20 different goals, and that's a lot for anybody to have to figure out. And that can actually cause a lot of discouragement if we're doing that. But our thing is that we always start off with about 3. We might build on that as they're getting more comfortable with it. We might say, okay, now let's look at that other situation that you were saying you want to be able to hear with. Unfortunately, maybe we're not going to be able to get that with just the hearing aids alone, but how do you feel about, adding a remote mic or something like that? So we can definitely get, I think, a little more specific with that too.
And I'm looking at our outline here, and for me, I really appreciated that it was still using the SMART goals, right? And
Yes.
which is great because we have been trained, right, to remember SMART goals, right? Specific, measurable, achievable, realistic, and time limited. And so I
Yes.
really appreciate you being able to structure it that way.
Absolutely. And I would say realistic is probably the one that we probably have to counsel the most about, because there's kind of like this thought process, I think, when people think that they get hearing aids, they're going to hear perfectly again. They're going to hear just like they did when they were 20. And they don't understand. And a lot of times it's not necessarily the patient that we're counseling about that, but it's their family members, because they think, oh, if you're wearing the hearing aid, I can talk to you from across the room, or I can talk to you in another room and you're going to hear me perfectly. And that's just not the case. So a lot of times it's established that those realistic expectations more for the family members than it is for the patient.
By using SMART, it really is that education of the family members, right? Of
That's
yes,
right.
yes, you're going to be able to hear, but for me, that's just fascinating of going because a lot of times you think of the hearing aid as me or us and but not the rest of the family. So
That's
that's
right.
great to hear. What kind of process do you normally see with family? Are they coming in a lot with patients? Are you working with them like as soon as they're set, but also giving them those expectations? Is it more of like a counseling?
Yeah.
Do you have, are there groups that you recommend, for like you would
Yeah.
have with like cancer patients and,
Yeah,
you know,
absolutely. And that'll probably be something we'll go into a little more detail. It's actually one of our best practices as
oh,
well, is kind of recommending on that. So we'll get that
awesome.
to
Sorry,
more
I'm
detail.
jumping ahead.
Not a problem. But yes, we always encourage when a patient comes in for hearing test to bring someone with them. One, because I always say that 4 years are better than 2 when we're going over results and things like that. But it also brings them into that process and allows me to kind of say, this is for the both of you, especially if it's like a couple. This is what we're going to do, and these are the expectations we're going to have. But I can also kind of encourage them to say, now that so and so has hearing aids, okay, this is how you need to talk to them, and these are the things that you need to do as a good communication partner. So it really does help with some things like that too. So yeah, we go over a lot of that as part of that process.
This actually podcast, the time has just flown by. Uh,
Awesome.
yeah, this is great. This is great information. So viewer, we are on plan. We are on number 4 of the best practices, and so that is where we will be ending this video. So we'll look at again the other videos are going to be coming up, and so please like, subscribe, and hit that notification bell so you are going to get those notifications saying, "Hey, this next podcast that we're going to continue on best practices is available to you." Dr. Moore, is there anything you would like to say or share as we come to this end?
Oh, I just would say thank you so much for the opportunity. And yeah, I look forward to our future endeavors.
Where can everybody find you?
So we are in Tucson, Sonora Hearing Care, Tucson.com. We're on Facebook, and I'm on LinkedIn as well, and Instagram, and all the socials.
Awesome. Thank you again for viewing, and we will see you in about a month. Have a great
Sounds
day.
great.
Bye bye.
Thanks.